Well, the charge nurse will sometimes come in and talk with the family and help calm them. I've seen nurses be very dismissive because they're feeling anxious and unprepared for the situation that's happening. But I think prepping families is a huge step. Prepping them before something happens. Like if you know somebody is so critically ill, walk them in the room and say, you know what, I'm here to answer questions. However, if it gets too intense and I'm not able to answer the question, it's not because I'm being dismissive, it's because I need to focus on this person right now. I think that's huge. Prepping them as much as possible without also freaking them out on the flip side, because they don't want to hear that this might happen. But they do, I think, want to know that somebody's there to hold their hand a little bit. I think including them as much as possible, telling them what you see. And I think one of the things that has worked well with families, two of the things that have worked really well with families, is getting chaplain involved very early, because they almost work as a patient liaison. When I'm working on the patient, getting their blood pressure up, they're there helping to emotionally guide that family. And I also have told family members, when I look nervous, you can feel nervous. You should maybe feel more nervous, but if I look okay and calm, it's okay. That's, you know, it's a dangerous gray area because not every nurse, right. But I think getting them to understand, like, we're here catching, we're here to catch, and we're here to help. We can't fix everything, but we're here to give them everything we can give them if that's what's appropriate. Has helped quite a bit, I think, ease those dynamics. I think also in the past we've kind of, if families haven't really done well with nurses or certain nurses, vice versa, we say that nurse shouldn't work with that family, which has been helpful, I think. And if they have requests for certain nurses, we try to honor those as much as appropriate. And that's helped as well. And I think what I don't see happen quite often enough is the families being involved in rounds. I think that would actually help hugely. When the few times I've been involved in rounds, and so maybe it's a little bit better, but you know, the time is never set. The families never know when they're coming. And usually even when the nurse says, I need this and this and this, they're kind of, you know, we're on a timeline, we gotta go, 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 go. And I think if they just allowed a little more time and included families, I mean, some families go days without being updated by doctors. And I think that's to the detriment of the family. They don't feel included. I mean, imagine having somebody in the ICU for 3 days and not hearing a thing. What are we doing here? What's the plan? You know, be a little more transparent about the plan, I think would help. And, you know, offering the forum for more questions and answers from the families. It would help.